For our final project, we created a parent's guide to vestibular disorders and pediatric vestibular rehabilitation therapy. Have you ever wondered why your child seems overly clumsy or uncoordinated? Is your child struggling to keep up with other kids on the playground and in the classroom? Does he or she seem to be struggling with hand-eye coordination? If you answered yes to any of these questions, then you might be surprised to hear that your child is not just clumsy. They might have a vestibular disorder that is the underlying cause of this clumsiness. Let's start by talking a little about the vestibular system. The vestibular system, which is located within the temporal bone of the skull, is essential for the development of normal movement reactions, motion tolerance, and motor control for postural alignment, balance, and vision. As one could infer from its many functions, having a vestibular disorder can lead to several negative impacts on your child's development. Vestibular disorders may be genetically acquired, caused by an ear infection or meningitis. Regardless of their cause, it is important to start treating your child as soon as possible. If the vestibular disorder occurs early in development, then it may impair the development of protective reflexes and equilibrium, causing the characteristic clumsiness and dizziness seen in many children with vestibular disorders. The sensation of vertigo, or an erroneous perception of movement, can be due in a child as in an adult to an anomaly in the normal function of the three major sensory systems, such as the visual system, the vestibular system, and the proprioceptive system. Because the vestibular system helps with vision through the vestibular ocular reflex, or VOR, which is essentially what helps maintain stable vision during rapid head movements, having a vestibular disorder will also impact your child's ability to see as clearly and as stable as someone with a normal vestibular system. Not having stable vision in itself can lead to problems in school, such as increased difficulty in learning to read and write, and also impaired the development of gross and fine motor skills, such as kicking a soccer ball or tying your shoe. As you can see, the impact of a vestibular disorder on your child's life and development go far beyond clumsiness. Fortunately, having a vestibular disorder does not condemn your child to live with its negative impacts. Vestibular disorders can be managed with vestibular rehabilitation therapy, also known as VRT. Children receiving VRT show a significant improvement in their quality of life on and off the playground.
We made a few clips showing some VRT activities that can help improve vestibular function. Jump rope is a fun way to get the child to experience different linear accelerations and head positions.
These two clips demonstrate subjects balancing on the medicine ball. Balancing helps the child to compensate for vestibular dysfunction by using more tactile information. Balancing while laying on top of a medicine ball, as seen in this clip, helps with experiencing different head positions, which assists with postural control. Our next activity is spinning. Spinning helps tolerate motion in general. It is important to not spin the child for a long period of time, as spinning causes the greatest discomfort. It is essential to stop if the child is experiencing too much discomfort.
VRT is a specialized exercise program tailored to address eye movement control, dynamic visual acuity, balance, developmental reflexes, and body movement functions. The use of vestibular rehabilitation for persons with balance and vestibular disorders is used to improve function and decrease dizziness symptoms. The goal of balance rehab for patients with vestibular loss is to help patients to 1. Use remaining vestibular function, 2. Depend upon surface somatosensory information as their primary postural sensory system, 3. Learn to use stable visual references, and 4. Identify efficient and effective postural movement strategies. It is important, especially for children, that VRT is tailored to suit their child's interests. Having the child engage in the program can help ease the discomfort that these activities can cause and can help the child keep engaged in the program. The more these activities resemble normal play activities, the more the child will want to participate in them and thus improve the overall effectiveness of the program. So remember to keep these activities fun.
Fortunately, children respond extremely well to VRT because their brain plasticity, that is, the brain's ability to adapt to our current demands and needs. You as a parent also play a major role in the success of the program. Your job will be to ensure your child along the way and to make sure that they perform some of the VRT activities at home. We hope that this brief video has provided the basic understanding of what vestibular system does, how a vestibular disorder can affect your child's development, but most importantly, how you can help your child by enrolling him or her in the VRT program.